Hello and welcome back to my channel. If this is your first time here, I'm Nurse Alyssa and today we're going to be discussing wound undermining. But first, if you could hit that subscribe button, it would be greatly appreciated as it truly does help my channel grow. So let's get started. So what is wound undermining? So it's the erosion of the tissue underneath the skin. So the skin, it might look like a wound's this big, but underneath it, when you probe just underneath the skin, with say like a cotton tip applicator, it's actually a lot bigger than what you can visually see. So that's your undermining. So what are the causes and risk factors? So really wound undermining is very similar to wound tunneling. So people who are slow to heal, so chronic health conditions, immunocompromised, they are slow to heal. So they're going to be more at risk of getting wound tunneling and wound undermining. So different risk factors. Patients with slow healing ulcers, wound infections, repeat trauma, poor wound care practices, comorbidities. If you have a comorbidity such as diabetes, chronic hypertension, you're at higher risk. Prolonged inflammation. So when a wound is stuck in that inflammatory phase, the wound is stalled, it becomes a chronic wound, they're at risk. Anytime a wound isn't progressing through the stages of wound healing, we are at risk for serious complications, okay? That's why it's so important to get a wound healing right away, getting the proper care. If you've had a previous surgery around that area, it's going to be harder for the area to heal. If you have recurrent pressure ulcers, it starts to become very hard to heal that area. That's why it's so important. Prevention over cure. That's what I always say, prevention over cure, because we want to prevent things from happening because it's a lot easier to prevent something than to cure it. Okay? If you're on corticosteroids, it is going to prolong the healing process. Immunosuppressants, same thing. It stops the healing process. It slows it down. It will take longer for these wounds to heal, putting you at risk. So signs and symptoms, okay? So fever, pain, edema, malodorous discharge, okay? So it'll have a very pungent smell to it, okay? You might also have the redness around the outside of the wound, have maceration, so that increase in wound drainage causing the maceration. This is caused by when we have that lip in the inside, we start getting more drainage, more fever, more pain, possible risk of infection, because this area, it needs to be filled properly and properly taken care of. So how is undermining diagnosed? So really it takes a wound care specialist or whoever's taking care of that wound to determine if it's wound undermining and to examine the wound properly, okay? Because sometimes half of the wound, it might not have the undermining, but the other side it does. So it does take a trained professional to have a peek at the wound and properly diagnose this. Okay, so managing undermining wounds, okay? So really what we want to do is prevent tissue loss, protect the peri-wound, and prevent infection, okay? Some strategies that we're going to take is treat the etiology. So what caused the wound, okay? Really treating an etiology, it's the same thing as preventing it. So whatever you had to do to prevent something. So how do we prevent a pressure ulcer, for example? We remove pressure moving somebody every 2 hours. So really, the strategy for treatment is we have to be moving them every 2 hours. So really, it's quite redundant when it comes to wound care. That's why I say prevention over cure, because really it's the same thing. So we still have to do all preventative measures to make sure that wound's going to heal, but then we still have to take care of the wound. That's why prevention is always easier. Symptom control, local wound care, filling of dead space. So when we have undermining or a tunnel, we have to fill that space, or it can cause an abscess if that wound closes. So we actually have to pack a wound, leaving a tail so the wound stays open at the top, but we're closing the inside. So we got to close that inside before we can ever grow it out to close the top, okay? And we do this by just fluffing, packing in. I say fluff because we don't want any excess pressure in there. If we have excess pressure, we're going to get a bigger internal wound, okay? So we fluff, packing, never stuff it. Okay, and then we can also use negative pressure wound therapy for undermining. So that's all I have for this video. I hope it did help you better understand wound undermining, and I hope to see you guys in my next video. See ya!